Hello. Hi, Mom.
Hi, my
How are
dear.
you?
I'm good. How are you?
I'm good, thank you. We are here to first introduce ourselves. So I will introduce myself and then you can introduce yourself.
Mhm.
I'm Lara. I'm the daughter of Dr. Anke. And we've decided to do videos for especially women who have questions regarding gynecology and what else?
Obstetrics
Hmm.
and preventive medicine.
Yes. And you
Okay.
are?
I'm Dr. Anke. I'm consultant for OB/GYN. In English, we always prefer the short forms. And I'm a doctor for preventive medicine. And the idea was born because we realized that a lot of women do not dare to ask questions. And
Yes.
we just want to encourage women to ask questions because I always say there are no stupid questions, but only silly answers. So asking to know more about their own body, about the things that are happening. And the better informed the person is, the less anxiety comes up.
Mm.
Yeah, because if we can decide this is normal for me, or I don't have to worry. This is always better than to live in anxiety and think, oh my God, what could this be? And is this something to worry about? Am I really sick? So this is how we want to support women
But
and encourage them.
actually it's not just women, it's also men, right? Because
Of course, but I'm not expecting a lot of men to ask questions because I think they have even a bigger issue to talk about health issues than we women have.
yeah, but
Yeah.
maybe women who have husbands or sons or anything like that, maybe they could ask for their family members.
If they like to, I'm happy to answer the questions. Yeah.
Cool.
But I wanted to point out something that is very important. So um, I, of course, try to answer the questions as good as I can, but sometimes I really have limited informations. Yeah.
Mhm.
And sometimes it's really essential that I see a patient or I do the exam by myself to really, because otherwise I'm not really able to confirm that the diagnosis of another doctor is correct or not.
Mm.
Yeah, so just by listening to words, it's really not always possible to find the right diagnosis, and that's of course a big issue for
Okay.
me.
So today we are answering questions in English. So it's actually not one specific theme.
Yeah, because we just wanted to give the opportunity to all women in English. Of course, is a language that most of the population understands. But nevertheless, I want to emphasize that if a person is asking in German, and I'm not sure if the person is able to speak English good enough,
Yes.
then of course I will switch to German because the woman needs the answer. Okay. But whenever we have the chance and we have time, we can of course translate things. So if
Yes.
you have any topics that you want to have more details on, just let us know over our Instagram accounts, and then we can even have episodes with just one topic, for example, HPV or breast cancer or whatever it might be interesting for you. We just need to know, yeah,
Yeah.
because we like to talk about things that are interesting for you, not for us.
Yes, right.
Okay.
So I'm starting with the first two questions because it's almost the same. I had an extrauterine gravity and the fallopian tube on one side was removed. So, how do I know if the other tube is also affected? And the
Mm-hmm.
second question, also regarding tubes, is it possible that closed tubes heal by themselves?
Yeah. Okay. So first of all, an extrauterine gravidity means that the pregnancy itself is not implanted in the uterus where it belongs, but it has implanted somewhere else. The most likely plantation area is the fallopian tubes. And the problem with the fallopian tubes, of course, in comparison with the uterus, they are not expandable like the uterus. The uterus is a muscle that can grow with the pregnancy, and then there is enough space for the pregnancy itself, the pregnancy product, the embryo. And if it's sitting in the fallopian tubes, the risk that the fallopian tubes are just breaking up and inducing heavy bleedings is the issue for the women. And if we diagnose an extrauterine, we always have to remove, unfortunately, the pregnancy to rescue the life of the woman, because otherwise we risk her to have a very heavy hemorrhage, which can even lead to death if we don't do something. Yeah? And if the tube is very much affected by or there's a lot of blood in the tubes, they sometimes have to remove the tube of one side. Mm-hmm. But the good thing is we have two of them. And we know by studies that even if we have only one tube, the tube, if it's fully movable, and it can also reach the ovary on the other side. So it means the tube goes to the ovary where the ovulation takes place. Yeah. Mm-hmm. So to answer this question, how do I know if the other side is open? The first thing that I would ask is, what did the surgeon say? So because he looked inside the abdomen, and because you can most probably see if the fallopian tubes look normal, if they look inflamed, or if at the end of the tubes there are some fingers that are catching the eggs. So if they are very filigrane and look normal, the risk that there is a problem with this tube is low. Yeah. But the best way, if you somehow need really a proof that it's open, there is a specific exam that you can do. This is called the hysterosalpingography. This means that there is an estrogenic substance injected into the uterus, which automatically goes into the tubes, or the one tube, the remaining tube. Mm-hmm. And this is visible in the radiology, and they can really see if this tube is open, because then the estrogenic substance is going through the tubes and ending up in the abdomen. Yeah. So this is the proof. Yeah. The risk, if the fallopian tubes from outside look totally normal, that there is a big issue with it, is low. Yeah. Because we have sometimes women that have only one extrauterine gravidity in their life, and they after that have normal pregnancies. Yeah? Mm-hmm. So never give up. Think positive.
Yeah, always.
Always. And the second was, what if the fallopian tubes are damaged? This was a case concerning a severe endometriosis. So the problem with the endometriosis is that it leads to a severe inflammation in the tubes, and whenever inflammation is healing, the tissue is developing scars. Okay. And also in inflammation, the body is producing a specific metabolite that is working like a glue. So means it leads that the tissues stick together. And this is why the tubes mostly are closed then. And the tubes have very fine fingers inside, which are helping to transport the egg. And mostly this transportation is also disturbed. So we have two issues. We have a transportation that is not good anymore, and we have sometimes really strictures or closures of the tube. And if the tube is closed, of course, there cannot come something through. Yeah.
So it's not possible to get them.
So there are microsurgical operations done in former times, but the chances were low. And because with IVF, the chances became better to help women that have closed tubes to become pregnant. This microsurgical preparation of the tubes is not something that is regularly done anymore. Mm-hmm. Yeah. So the likelihood, if there is really scars and severe inflammation, that the tubes opening again is very, very low. I mean, you are never allowed in medicine to say 0, because in medicine there is no 0%. Yeah, but the likelihood is unfortunately low.
Okay.
Okay.
Yeah.
Good. So.
Okay.
Du kannst jetzt Pause drücken.
Ich drücke. Okay, so let's start with the next question. The next question is, I have a copper IUD and I'm gaining weight. Does this come from the copper IUD or the thyroids?
Okay, so first of all, the copper IUD is having no impact on your hormonal balance, and also no impact on the metabolism.
Yeah, what so is the copper IUD?
Yeah, so we have different types of IUDs. IUDs, intrauterine device. Yeah, in French they say stérile. In German we say Spirale. Yeah, so they are different, but everything is, it's a small device that is placed into the uterus to block the implantation of the egg. Okay, and the normal ones, or which we call normal IUDs, is the copper IUD. So it has copper in it. And this copper is inducing a mild inflammation of the endometrial lining in the uterus. And this is helping that an egg is not able to implant. Okay. Mm-hmm. But the copper IUD, because it has no hormones, has no impact on your metabolism. Yeah. This is why the likelihood to gain weight within copper IUD has nothing to do with the copper IUD. Mm-hmm. Whereas the thyroids, of course, can have an impact on the metabolism, especially if you have a hypothyroidism. That means that the thyroids are not working properly. Mm-hmm. Then people or patients tend to gain weight. Yeah, but this is something you can treat. So if you have a hypothyroidism, you need to substitute the thyroxine, the thyroid hormones, and then the metabolism is stabilizing. Yeah. And to be honest, mostly weight gain is not only because of one thing. It's mostly cofactors. Yeah, it can be the less of exercise. It can be change of aging, for example. So if you age, your metabolism is changing, so you gain more easily weight and it's harder to lose again. Yeah, so there are so many factors. It's never only one single thing.
Yeah, stress.
Stress, of course. Stress is increasing the cortisol levels, and cortisol is increasing the blood sugar and the insulin levels. And as long as the insulin levels are high, you have no lipolysis, so you are not able to burn fat. So this is why I say there are different factors that play a role. It's rarely only one single factor. Mm-hmm. But the copper IUD, I can say very, very untypical.
Okay.
Gain weight with copper IUD. Okay.
Mm-hmm. Stop it.
Okay.
Okay, so our last question for today is, my daughter is 14 years old. Is it advisable to go with her to a gynecologist?
Okay. So just because she's a girl and she has her period, she doesn't need to see a doctor. But I think it's always a good idea to bring the young ladies close to a gynecologist for several reasons. So first of all, they need to understand that the gynecologists are human beings too. Yeah. And if you were once there and had just a conversation to get to know each other, it's for them much easier to come again if they have an issue. Yeah. And of course, I mean, I have two daughters too, so I'm sure, although I'm a gynecologist, you did not discuss everything with me. That means,
yes, I did.
Sometimes it's easier to talk with a stranger, yeah, and not the mom. Okay, yeah, and you understand what I mean. Of course, we discussed. You are very open-minded, and Samira the same, but. I can understand that not every mom has the same relation to the daughter, and sometimes the daughters would rather like to speak with a friend about issues than with the mom. And then the gynecologist, of course, can support the mom because she doesn't need to have any worries about the girl. Yeah, so it's more like giving her the opportunity to ask questions. Yeah? to understand what is happening in my body, why are we bleeding every month? Yeah, because I always say if you understand what's going on in your body, it's always better for the future.
Yeah.
And of course, I mean, not every mom is a gynecologist. That's the other issue. Yeah. So of course, I can give her more medical advices than a mom normally can do. That's okay. Okay, Lara, I think this was it for today. We don't want to extend our episodes too long, but I just wanted to emphasize that I have 2 additional questions, one concerning endometriosis and heavy periods, and the other one was about some issues after deliveries. But I want my problem really is that it's not easy to give you a good advice if I don't know all the details. Yeah, because for example, this lady is asking, should I remove my uterus? So there are several factors that play a role. Of course, the age, the position of the fibroids. She has also an endometriosis. Then she's asking, is it good to do it open surgical? So this is very complex issue. And it's not really easy to give you a good advice, an individual advice. Yeah. In general, I can answer if you have heavy periods and fibroids, the likelihood the fibroids are a reason for the heavy periods is given, of course. And if you remove the uterus or a part of the uterus, the part that is bleeding, the bleeding will be over. Yeah. But to decide if this is the right decision for the person individually, I need to have more details. Yeah. And the same is with this patient after delivery that has bleeding disorders and there's some swelling in the vulva. It's very hard to decide what this is if I haven't seen her. I didn't examine her. Yeah. But she will do an MRI, so I hope she keeps me posted. So because with the MRI, I can work a little bit better because I have just simply more information about what is going on there. Because if I didn't examine her, I really cannot answer although I would like to, but I need more information.
Yeah, but that's a good information for all the women out there. If they have specific questions, they can just give you more details.
Yeah. And we are collecting all the questions over the week, and we meet once per week, and then we can discuss even detailed questions, of course. But don't be disappointed that we cannot do too much per episode, because otherwise nobody will watch the full episode. Getting boring for those that are not interested in the topics. Yeah. But we have to start somehow, and this was the start in English. So I hope more women are asking questions in English, so we can go ahead.
So thank you for listening our podcast.
Asking questions.
And thank you for asking questions. See you next week.
See you soon.
Bye.
Bye.